about vaccines. And for us working in public health, that is a huge shift and a very welcome shift. Accompanying that has been a surge in misinformation and also disinformation, which is more the deliberate spread of false information or fake news. And this is something that we have come together as partners to tackle. Also, misinformation costs lives. It undermines public trust and confidence in life-saving vaccines, not only in COVID-19 vaccines, but can impact other routine childhood immunization. And without trust and accurate information, people hesitate to be vaccinated. And without people vaccinated, their lives are at risk, and the virus will continue to thrive. And the pandemic will unfortunately continue. And the longer the pandemic continues, the worse the impact there will be on children and their families. So vaccines are key to protecting people's lives, ending the pandemic. But to do that, we need to have public trust and confidence in vaccines. And at the same time, people have understandable questions and concern, particularly about new vaccines, and COVID-19 is a new vaccine, or they lack adequate information. And a recent study of Kenyan youth found that 2/3 who were hesitant to be vaccinated when vaccines became available was because of inadequate information. And the youth felt that they would be more likely to be vaccinated if information was openly shared. So the second part of the question, what is our response? Well, first, we need to learn. We need to learn to listen. We need to understand the concerns and issues and conversations in order to develop vaccine communications. And our new partnership with Facebook, with Yale, with PGP, takes this understanding along with behavioral insights and develop the rapid testing of messages tailored to different people's needs, so that to ensure that messages resonate and reassure them. But I want to stress that what is really amazing and new about doing this with Facebook is the rapid testing capability, the real-time feedback, and the mass audience reach, which means we can test and fine-tune messages at scale and at as fast a pace in a way that previously wasn't achievable.
Thank you so much, Diane. Sad, we are following so closely all the new research and the expertise of Yale on this issue. What is your take on these rapid changes that we have seen on communication on vaccines in the last months?
So this has been a very interesting evolution of the ecosystem around vaccine discussions and vaccine messages. We have known for a while that vaccine acceptance is a spectrum. On the one hand, there are those who would refuse all vaccines under all circumstances. Fortunately, there are usually a very small proportion of the population. On the other hand, are people who are vociferous acceptors of these vaccines, people who demand vaccines actively. Within the middle are a whole range of individuals, those who are on the fence, the so-called fence-sitters. Others are, who don't necessarily think about vaccines every time they wake up in the morning. So in this pandemic, what has been different is that those who demand vaccines actively have been way more vociferous than normal. And that has led to a perception, or that led to, unfortunately, the perception that those of us who work on vaccine communications and acceptance interventions, wouldn't have to work hard to make sure that people get the right information and the correct information and timely information. So that was one of those things. And those of us who have been in this field, fortunately, was able to recognize that we shouldn't be lulled into thinking that this will be an automated task. The second thing which is different is that the vaccine conversations have been folded into people's sense of themselves and their underlying values. The values part was less of a surprise because that was on our radar screen, but the extent to which, and that's all around the world, because of the salience that Diane pointed to of these discussions, these discussions are now part of what people think, who they are. And so that has posed interesting challenges and opportunities to communicate around vaccines.
No, absolutely. And Joe, I know that from your very extensive experience on public health, that must be one of those challenging moments to be really very attentive of how the trends are changing. What is your take of the situation?
It has been very challenging. I would echo what my two fellow panelists have said. We have seen a exponential increase in the amount of misinformation and disinformation that's been circulating since the beginning of this pandemic. And we do know that how people feel about vaccines is a reflection of their values and how they feel their place in society is. And during the middle of an ongoing pandemic, we have the institutions of society that are under attack because of a lack of resources. So we have very stretched public health departments and governments and healthcare organizations that are in the middle of trying to respond to a pandemic, but also are trying to respond to misinformation and disinformation at the same time. And people feel that. You can see that in the messages that are circulating through social media. If firefighters have 15 things to do in addition to fighting a house fire, that house fire is going to burn brighter and longer than it would have otherwise. And that's how I tend to think about this challenge of answering all the very understandable questions that the public has every single day. And the only way we're gonna actually be able to do that at scale is through partnerships, like the partnership that we're talking about today, and through new innovative ways of getting health communications and vaccine communications and programs focused on vaccine demand out that reflect the needs of communities at the scale of the challenge, which is a global pandemic.
Absolutely. And KX, we know that you have been leading the charge in Facebook on how to be adjusting and developing new strategies to tackle misinformation and to be building on the very good research to be really contributing to enhance the vaccine confidence. But we know also that this is a huge challenge, and we know that the fight will be short term, but also especially long term. What has been your thinking, your challenges? What do you think are going to be the key next steps for Facebook?
Thanks. As Diane mentioned, there's been an increase, in some cases pretty significant, in the overall conversation about vaccines, both offline and online, and both accurate and not. The goal can't be to get the inaccurate conversation to zero, since, in a lot of ways, this is a reflection of society and how people talk about things both offline and online. And vaccine hesitancy has always existed since vaccines exist. At the same time, what we can do is help partners meet the needs of people where they are online and leverage a lot of the unique properties of our platforms to get good information out, like scale, reach, and personalization. And so that's what we've been really focused on. At the end of the day, people ultimately want what's best for themselves and their families. Right? And I think, as people have mentioned, it's understandable that they have questions about vaccines. So that's kind of how we've been focused. In terms of specific approaches, three things we found to be effective so far in concert with our partners. The first is getting people's questions answered. Since the start of COVID, over 2 billion people have gotten authoritative, credible information about COVID and vaccines on Facebook. We expanded our facts about COVID units into people in newsfeed. This has reached hundreds of millions of people worldwide. And some of our research across 5 countries found that this messaging resulted in a 3% increase in beliefs in important facts, such as the fact that the COVID vaccines have been tested for safety. Second big thing is talking to friends and family about getting vaccines. Experts have told us that people are more likely to get a vaccine when they see that people they trust are doing so. And so we've built these profile frames in partnership with UNICEF that lets people share that fact. And they're now live in 70 countries. And lastly, making it easier to get vaccinated and get access to health services. Access still is a big issue, even for people who do want to get vaccinated. And obviously, this is not just an online problem, and a lot of the solutions are offline. But In some countries, people can now use WhatsApp to find out whether they're eligible or not for a vaccine and book a vaccine an appointment. In Indonesia, 500,000 medical workers registered to do this over WhatsApp in the first 5 days of the service being available. That's a third of all healthcare workers in the country. So, we're excited to see some of the early results here, and there's a whole lot more we need to learn and work on together.
Indeed, KX, we can say that in a lot of countries, people are really hungry for reliable, credible sources of information, and as you say, to get the right answers in a timely manner. And I know that we have at the moment a very strong collaborations with Facebook in so many countries, and this is one of the key content that people are really looking for and searching for when they come to UNICEF or to the Ministries of Health or to any other organization they believe in. But what it is really incredible, I think the first time ever we have seen is such a collaboration between 4 entities that we are committed for vaccines, but perhaps we have not been able to be working at such a scale before. And I think this is perhaps what we would like to be diving into in this conversation. What brought us together? What is the added value to be engaging in such an ambitious research project to make sure that every single country can benefit from better messaging, better communication around vaccines? So I hope you are going to tell us the story about that. And this is just an open conversation with all of you. But perhaps, Diane, do you want to kick off and explain us how this came to happen?
Yes, the vision. Well, the vision was country-driven, which is where UNICEF, again, this is where its strength is. So early in the pandemic, many UNICEF country officers sought support to combat the surge of misinformation in social media. And what we found through a quick analysis was that countries needed effective social listening systems and the capacity to analyze data. So it's like the brave new world of communication. More and more countries, more and more people are accessing social media and using those channels, particularly around the time of the pandemic. So with the rapid spread of misinformation and the urgency around the need to scale up a robust response to counter misinformation, UNICEF reached out to partners, PGP and Yale, to set up what was called the Vaccination Demand Observatory. And each partner brings to the table their own unique knowledge and experience and assets around 3 key pillars, which is one is social listening, the second is analytics and behavioral insight generation, and the third is to design the effective communication interventions, which we'll talk a bit later. So it's set up similar to a disease surveillance system where the partnership sets up local level social listening programs that can track and analyze people's vaccine conversations, questions and concerns, and after the analysis, provide recommendations to local level health agencies of real-time actionable insights and communication interventions to respond to that misinformation. We have to be, as agencies, as light on our feet as those rumors and misinformation that's coming through social media channels. So UNICEF is equipping country officers with tools, training and technical know-how to do that. And as I mentioned earlier, with the Facebook partnership with UNICEF, this also has allowed us to leverage the bulk data insights through Facebook and to also leverage a digital platform with enormous reach to counter the misinformation and to spread accurate, verified information.
Well, thank you so much, Diane. And I imagine KX, always Facebook thinks big. What was the big idea that brought Facebook to this collaboration?
When UNICEF first approached us about supporting their work with Yale and PGP, we were delighted to contribute. Our entire team, and again, this predates the pandemic, is focused supporting health experts to help the people they serve, right, and including online. So, and a big part of this is actually supporting data experts with data and insights and providing faster, quicker insights to perform their own public health communications or prioritize their own efforts. So in the context of COVID, I think there's two specific programs that we found to be really, really helpful that we're hoping to build on. The first is this global survey that we've been running with Carnegie Mellon University and the University of Maryland. We believe it's one of the largest ever health surveys conducted. Over 70 million total responses have been recorded, and about 170,000 responses daily around across 200 countries. So the scale of this is pretty unprecedented, and it provides a kind of a level of time granularity as well as a geographical granularity that hasn't really been possible before. And so it's been used to understand behavioral trends like mask wearing over the last couple of years, as well as in the last year, specifically things around vaccination. So that's kind of one of the things we found helpful. The second thing is really around insights on conversation that was mentioned earlier. So as the developments around vaccines or the pandemic evolve, understandably, people's questions evolve too. And so having kind of a faster feedback loop to understand what are people actually talking about? What are people wondering about to inform kind of the messaging to be responsive to those needs is very important. And so by analyzing some of the trends in public conversations, our Insights for Impact team was able to provide UNICEF and Yale with some of these analytics to hopefully support those efforts.
That was really extraordinary support. And Dr. Omer, I imagine that Yale has been one of the pillars for this initiative. What for you is going to be the big contribution of this collaboration?
Yeah, I think the collaboration is novel, both in its scale, ambition, but also in approach, in this collaborative approach. And so let me sort of describe what we are doing, with our partners at UNICEF, Facebook, and PGP. Vaccine acceptance is based on different levers, which can be targeted through effective messaging. And often the focus is on people's thoughts and what they, and their attitudes. However, think of this like Russian dolls. So within, thoughts and feelings are a little bit more superficial, and underlie are these attitudes and then trust and social norms. But under all of this are the values we bring to the table. And we think of it, we borrow from this, the moral foundations theory, and we think there are 6 global values, but they are differentially emphasized in different populations. So each individual and each population has its own moral matrix, if you will. And so these values are, for example, care, fairness, loyalty, authority, purity, and liberty. And so we had done, even before the pandemic, some work to show that often vaccine decisions are moral decisions, are value-based decisions. But keeping that in mind, there was this opportunity to come up with evidence-based messaging with the end goal to empower countries and country offices to take the lead in deploying these interventions at the local and the national level within various countries. So we had, a budding collaboration between Yale, UNICEF, and Facebook, and then PGP to develop these messages. We did a pilot in 2020, and then partnered with not just UNICEF headquarters, but also country offices, and then PGP on creative design and having this iterative process that is responsive to country needs. And the overall approach of this project that I'm talking about, the intervention, is to work across 5 countries, and we start with insights that is, comes from our Facebook colleagues. And so the data for good analysis that our colleagues at Facebook perform to generate insight, and this is for public posts, to generate insights in context to help identify what levers can be used for effective messaging. Then we work with our partners that I described, including country-level partners, to design and then go through this iterative process of developing these messages. and narrow down on the kinds of messages that we want to test. And then we go ahead and test these messages. And these messages are pre-tested for their potential to strengthen vaccine confidence and public demand. And the last phase, and we have gone through these first three phases, and the last phase is to actually deploy a narrower set of messages, but at a much larger level, and to actually measure coverage through these cluster level, geographically randomized clusters of interventions will be used to assess the impact on actual vaccine uptake. So that would be sort of a novel, truly novel contribution, although other contributions are also fairly novel. So we already have some results from the first three stages, but I think the contribution will be not just in the context of these 5 countries through this partnership, but also developing these tools and then disseminating across other countries that are interested in these kinds of interventions.
It's really exciting to know that very soon we will be able to be sharing the learnings and sharing the outcome for everyone to be using. And let me now move to Joe and the amazing contribution that PGP is doing into this project. What will be for you your main contribution, your main idea, and why you joined this initiative?
Well, I can't think of better partners. This is an audacious initiative. It's grand scale. It's extremely ambitious, but I think it meets the need that we're all faced with. We talked a little bit about the challenges earlier in our talk today, but out of crisis often comes opportunity. And I think we are all interested in using this ongoing crisis as a way to double down and explore innovation, and use the energy that's out there among the public and among our own institutions to push forward the best ideas from industry, from the private sector, and from the public sector. And I think that's what this represents to me. This is the first time the world has ever attempted to create a means to support country offices and community partners with essentially market research and public health research put together for immunization programs for vaccines on a global scale. So we're trying to do the equivalent of what the most well-resourced market research department in a Fortune 100 company would have at their disposal, a company that sells products in every country in the world. We're trying to have that level of insight and resource, and then pair that with the decades of experience that UNICEF has on the ground in communities all over the world, managing immunization programs with local partners, putting those two things together, and then just the technological powerhouse of Facebook behind that, and the university academic scientific expertise of Yale behind that. It's a really, really exciting project. And our role is essentially to help with the project management and then to help with the iterative process of local country offices, local partners, synthesizing all of this best in practice into things that could actually be shared, that can spread through social networks, that answer the direct requests of communities coming through UNICEF offices.
But Joe, I mean, spot on. I don't think that any of us could be having the ambition to have this extraordinarily in-depth research capability on our own. I think that the power of coming together and being able to be in such a fast pace, benefiting and adapting to more than 100 countries, we have never seen it in UNICEF in our 75 years of history. So perhaps now let me move into learnings, into results. We have so many people listening to us that are thinking, how can I learn from this exercise? How can I make sure that this effort is going to be increasing the number of people protected by the vaccines, especially in countries where, as we know, the pandemic still is causing a lot of deaths and a lot of suffering. So let me move into those learnings. And perhaps, Dr. Omer, you were already hinting that this was going to be one of the most exciting parts of our collaboration. Could you just give us an initial glimpse of what we can expect and what we have learned so far?
Yeah, so we are excited to share the learnings from this 5-country message testing initiative where we randomized these sort of messages and these campaigns to create high quality data on what messages are helpful in moving people's attitudes. And as I said, the next stage would be to test it against increasing coverage. So what we achieved so far from Insights to Impact was to in these 5 participating countries, 27 campaigns were designed and launched with our partners. And, we were given, this initiative was given ad credits to run this test from UNICEF country offices. And tens of millions of Facebook users were reached with strategic messaging content. So just I want people to appreciate the scale of this message testing, so that we were able to look at 27 different permutations and so that we can fine tune into the most promising one for the next stage. So the initial findings were, and the initial learnings were, that context drives design, and it should drive design. And so it is local engagement of, for example, UNICEF country offices and other partners critical to ensure that the content resonates with the audience. A same woman in Philippines promoting a similar underlying message should and does look different in our messages in Pakistan versus the Philippines versus India, for example. And so these lessons we learned together, and some of them were part of our starting strategy as well, but they came into relief during this initiative. The other thing we found empirically from the data is that it's the mix of images and illustrations works really well in this medium, and that the content should be tested in multiple languages. And what we found, so look, there were, obviously we knew that messaging should be context specific, as I mentioned a little bit earlier, but there were some interestingly universal lessons or learnings that cut across different countries. And the fact was that almost universally, almost invariably, messages in local languages, even in countries like India and Pakistan, where English is spoken as very widely, the message in local languages were perceptibly more effective. Hopefully, they'll be infectious in a positive way in terms of going viral. But that was a pretty consistent learning. The other thing was that our campaigns achieved significant recall across various settings. And we obviously relied on social listening, local intelligence, and behavioral science to come up with these messages. And then the other lesson was that value-based campaigns shifted attitudes towards vaccine confidence across the board, or in almost all countries and all situations. The values-based campaigns came out to be the more powerful or more potent tools to change people's attitudes. But I would highlight that what values were emphasized was highly local. But as a concept, values were pretty useful as a tool around which we could message. And we, many users clicked through for additional information and resources in response to the ads. And so we were able to measure some of these proximal outcomes. So just to summarize, big picture partnership works, and we have to leverage these kinds of partnerships between different players that are represented here, but also with country offices and various country level partners in a pandemic for effective communication. Language matters, and we can't assume that the same message will work in English, even in country as well as it works in local languages. So language matters. Values-based messaging shifts attitudes, and lastly, context is key to moving the needle.
Wow, well, you couldn't have summarized better. Language matters, and local languages, and as you say, that values matter when we are talking about vaccines, when we are talking about confidence, and how to be, of course, talking about science, but also to make sure that we have a value-based communication is going to totally shift the way we are hopefully approaching and helping on this issue. And context. I think this is the value also of this collaboration, that the pilot countries were really countries in very, very difficult contexts, and hopefully that approach will help to be expanding globally this collaboration. But Joe, PGP, you are the experts on messages, the experts on content. What do you think you have learned with this new approach? What do you think that will change in your way to work around vaccine confidence thanks to this collaboration?
I think the biggest learning for me, this was intimidating when we started. The scale of this is intimidating. And I think there was understandable skepticism in the field of public health and immunization specifically, whether something that was this large in scale could function while providing the tailored level of messaging that we all know is needed at the country level and in the communities within a country. To me, that question has been answered. I think it is possible. This clearly demonstrates that we can do it. If you get the right partners together in a Zoom call, magic can happen. And I think that there's a lot of opportunity for expanding the work that's already been done and improving upon it. There's a lot more work to be done. And there's a lot more seats around this table that need to be filled, and we all understand that. But this is no longer a theoretical to me. This is now, the pilot's concluded. We know it works. We know where we need to double down and do more digging. But it's about rolling it out now. And it's about taking the lessons that we learned and getting it to every country that UNICEF's in, and getting that support to country offices who are openly asking for it. So that's the biggest lesson for me, is you can actually meet the needs of countries, meet them where they're at, by bringing science to them and tailoring it to what they're asking for at the scale of the globe. And that's, I can't think of a bigger lesson learned than that for me.
Well, Diane, I know that you are the brain and the heart behind this initiative for us in UNICEF, and I know how grateful we are to be able to be partnering with these with the global experts around vaccine confidence. What do you think that for us in UNICEF has been the big learning? It's the first time we did this partnership. I'm sure we have learned loads and loads.
And I agree with what Saad and Joe, they've covered this question very well. So I'm not going to repeat what they said, but that is the main body of what our learnings are to date. But as Joe said at the beginning, what is really unique is that we are applying approaches that are utilized in marketing, retail marketing, and we're applying them to a public global good, vaccines. And that's a first. Immunization hasn't in the past used social marketing. And so this really rigorous application of retail marketing approaches is something fresh and new. And then being able to have strong partners like PGP and Facebook have just allowed us to accelerate this work. And Saad covered the 5 countries where we're having initial results. But just to give it a little bit more granularity, because I know listeners would like to hear what is happening in a couple of the countries. So, and Saad had mentioned the focus on the values. So in the Philippines, what we're finding is that there's been a strong positive effect on people's attitudes to vaccines through storytelling from trusted messengers, like health workers, like parents, but also the fact that the messaging focused on a moral value of liberty. And this in itself provides an exciting new way of communicating about vaccines. Another example is Pakistan, with strong effects coming from personal testimonies that refer to equity. So the moral value of equity came through, with everyone having a fair chance to be protected by vaccines, and testimonials that said, now it's our turn to be vaccinated, and that has activated people to get vaccinated. So reinforcing what my colleagues have said, getting the right messages, the right tenor, tailoring messages to different communities really takes an understanding of people's information needs and of social behavioral factors that influence their vaccination decisions. Because, of course, deciding to be vaccinated is a more complex process than deciding to buy a product. And I think this collaboration and our collective efforts to develop more effective pro-vaccine communications is going to build ultimately more public confidence in vaccines, but it's also going to shift the needle on communications for vaccines. And the lessons learned will have far-reaching implications, not only for vaccines communication, but also future advocacy and behavior change messaging.
Thank you so much, Diane. And perhaps for our audience, it will be good to also hear from the pilot countries directly. How have they experienced, how have they implemented this initiative, and what are the initial learnings? Let us hear from our UNICEF colleagues in Ukraine and in Pakistan about this research and the impact that they already are seeing on the ground.
We are thrilled with the opportunity and partnering with Yale University and Facebook. COVID presented unprecedented challenges against us. We needed new ways of reaching to our audience. Our objective was making every child to have best health, every child to reach to best education, and how we can do it during COVID time. Thanks to the tools that are provided by Yale University and Facebook, we can imagine big, and we can reimagine a future for every child in helping people to make right decision, empowered decision to get vaccinated, to promote COVID prevention measures. Thanks to the partnership with Facebook and Yale University, today, on 1st of September, all schools across Ukraine was open, and it was only possible with communicating and getting more people getting vaccine, getting more people getting right messages on adapting behaviors. And this is only possible with partnerships like the one that we have, when we use big data, when we can reach to a big number of people, and when we can help them to make right decision.
In Pakistan, we've been having child immunization campaigns for the past more than a few decades. And we have started engaging on digital media in the last couple of years because we felt the need of engaging with our audience through digital platforms where public opinions are formed. A lot of key influencers tend to engage with them, and they form public opinions which actually trickle down to the community level. And this partnership provided us with an opportunity to look at data insights, looking at the public's preferences, information needs, what sort of content resonated with them, and how could we use that data to develop more targeted digital media engagement strategies for the public for the COVID-19 vaccine rollout across the country. The government also looks at and looks forward to having these insights from us so that they can get more data in real time on people's information needs and address these issues as they come along. So it's literally handling the situation in real time instead of waiting for a period of time from the regular field level researches and other data sources to process that information, whereas these sort of data insights provide us information in real time, and the government is really happy with this sort of a partnership. Initially, when we started the study and when we started this partnership, we always assumed that videos were more powerful and accepted by the public. Whereas we are getting some really interesting findings from the work that we've done so far. Illustrative images or field images, we found out, are very attractive to the public. They tend to resonate more with the kind of information that they require from the government. They're more popular because we try to introduce a campaign around social accountability, where we were trying to encourage grandparents and grandchildren to get vaccinated for each other. And that sort of a movement was very well appreciated. And these are the kind of messages which are becoming more popular.
KX, it's been extraordinary to hear about the pilot countries, but 5 countries is just the beginning. So I imagine that now, very soon, we have to be hands-on on how to be scaling up this initiative. How do you think that we should be approaching the scale up so we are fast, but we are also aware of how difficult and challenging is to be moving the needle on vaccine confidence in so many different regions and so many different contexts?
One of the really unique things about this whole, what we've been talking about today is actually the model itself. It's so interdisciplinary, and it really brings together different strengths, from like Facebook, online platforms, health communication experts, public health experts, marketing experts. And what we've really realized, and what I've really learned over the last few years in working on this space, is the best solutions actually happen when these different disciplines and different expertise comes together toward a shared goal. And it's been so rewarding seeing that not just be a theory, but actually applied in practice to this program. So we've been thinking a lot about how we can scale this more broadly. And again, one of, I think, the unique strengths of online platforms is the ability to go from translation, like take translation of theory to implementation to measurement in terms of understanding what works, and then to scale in potentially much faster cycles than were possible before. So you're talking days to weeks as opposed to years. And we're seeing this play out in the work here. We're already starting to expand to additional countries. And that's something we really want to continue. The second thing I really think there's a big opportunity around is to just further accelerate learning on how meeting people where they are online can help change behavior and over time improve health outcomes. A lot of what we discussed today shows some early learnings here, and I think there's just so much where we could be doing to replicate and scale what works and learn from what does not. A few of the more interesting things that I think we could learn from that weren't already covered today. First is our work on blood donations and the blood donations tool, which really was done with partners and in a very interdisciplinary approach designed to help people get more awareness about the needs and benefits of blood donation and clear up common misconceptions. And this is something we worked on for several years. And when we rolled this out in the United States, we and our partners did a difference in difference study. And I think promisingly, we saw a 19% increase in first-time donors showing up at blood banks associated with the rollout of that tool, with similar results in India and Brazil. And so that's another example of how I think a lot of the principles that we're talking about here and the approach that we're talking about here isn't actually limited just to COVID-19 vaccination, right? I think a lot of what we're learning here actually can be applied to other things. Another example, I think this was recently published in Nature Medicine, is a cluster randomized study that found that ad campaigns featuring physicians and nurses asking people to stay home and not travel led to significant reductions in travel in the 3 days leading up to the holidays last year in the United States, as well as some reductions in COVID-19 infections following. So I think we're starting to see a lot of examples of directionally things that work, and I'm quite excited to see if they replicate. And then work together to scale. And this is going to be a whole of society collaborative effort, and I really want to build on the things we've talked about today.
Okay, count on us. Count on us on the way ahead, because I think that this is going to be a critical tool or contribution to get the world vaccinated ASAP. And Diane, how do you think that UNICEF can benefit from this extraordinary partnership to really be scaling up and moving to the 190 countries where we are present?
Well, scaling up looks very good. And this is a primary objective of the partnership, is to go to scale. The power of UNICEF is its in-country presence in so many countries. And then we also, our focus on capacity building. So we are working with countries to build capacity around these social listening systems, and also where the systems are not yet in place, to train countries on behavior change communications. So when the methodology and the framework is ready, they will be able to rapidly go to scale. We want this work to be scaled up beyond this partnership. That's our ultimate goal. And for governments and for policymakers to invest in research and insights as much as they invest in the vaccines themselves. Because if we don't invest sufficient resources in the demand side, the vaccine acceptance and uptake of vaccines, then the risk is that vaccines will be delivered, they'll be rolled out, but people won't come to have the vaccine in their arms, and they will end up as wasted vials, which would be a huge pity and is not going to get countries out of the pandemic, and it's not going to protect people from both death and long-term disability. So it's really key that we work together with countries to scale up, and that we can also provide a really clear case through the evidence, through the research, to be able to show to policymakers, to ministers of finance, to ministries of health, the crucial importance of investing in vaccine acceptance and uptake.
Thank you so much to all of you for this conversation, for all the work, and hopefully for your championing of this collaboration in the future. Let me leave everyone with 3 takeaways. Collaboration, collaboration, collaboration. We are all in this together. And what we have shown is this possible to do when 4 institutions like us come together is something that can be multiplied by 100 times if we also bring many other partners who join our efforts to be building confidence in vaccine. The second takeaway is research, research, research. Test, test, test. And the importance to make sure that research, that testing translate into real action, real policy, real changes in attitudes, beliefs, behaviors. It is important that we keep investing in research and that we keep investing in communication. We are very grateful for the whole support of so many countries, governments, corporates, donors, to make sure that the investment in vaccines, especially on COVID vaccines, keeps growing until all the world gets vaccinated. But if we don't invest also in how to build the vaccine confidence on those vaccines so they get to the arms of the people, we will not be investing in the smartest way. So collaboration, research, and investment in communication for vaccine confidence are going to be 3 of the calls to action that we hope all the decision makers can hear at global level, but also at national level. I imagine this is just the beginning of an ongoing conversation and an ongoing, hopefully, movement to keep building confidence in vaccines and to make sure that collaboration is going to be our DNA on how we are going to be working together to end this pandemic. Thank you so much to all of you. Thank you.